We have got 35 questions. And let's start. So the male reproductive system includes the penis, epididymis, prostate, seminal vesicle, penis, bladder, prostate, testes, bulbourethral gland, vulva, testes and scrotum, spermatic cord, ovaries, testes and scrotum. Question 2. Immature sperm develop and are stored in the epididymis, prostate, bulbourethral gland, seminal vesicle. Question 3. The function of the scrotum is to compress the testes which support the vas deferens, allow the testes to be kept close to the body to maintain a temperature above body temperature, allow the testes to sit below the body to maintain a suitable temperature for sperm production, allow the testes to be retracted if the man is in danger and keep them safe. Question 4. The function of the prostate is to add fluid to the bladder, add fluids to semen during ejaculation, apply pressure to the urethra to prevent full emptying of the bladder, or remove moisture from the urethra. Question 5. Which structures add fluid to seminal fluid? Prostate, seminal vesicle and testes, bulbourethral gland, prostate and seminal vesicle, prostate, seminal vesicle and urethra, bulbourethral gland, bladder and seminal vesicle. Question 6. The female reproductive system includes the ovaries, bladder, uterus, vulva and mammary glands, ovaries, fallopian tubes, uterus, vagina and mammary glands, ovaries, bladder, uterus, testes and vulva, fallopian tubes, vulva, vagina, bladder and ureters. Question 7. Ovaries are small glands about the size of an almond, which store female sex cells called ova or eggs. Don't worry about the difference between ova and eggs. In this course, we use them interchangeably, although they are slightly different things. So ovaries produce new ova each month during the menstrual cycle, store 1 million immature ova, which are present at birth, start producing ova at puberty, store 20 million immature ova which are present at birth. Question 8. Fertilization occurs in the ovary, uterus, fallopian tubes, epididymis. Question 9. The uterus is a hollow organ which provides nourishment to fertilized eggs, the site of fertilization, inferior to the vagina, inferior to the cervix. Question 10. Zygotes form during the process of mitosis, meiosis, fertilization, menstruation. Gametes form during the process of mitosis, meiosis, fertilization, menstruation. Question 12. The follicular stage of the menstrual cycle includes menstruation followed by rising FSH, ovulation followed by pregnancy, luteinizing hormone rising creating corpus luteum, menstruation followed by falling FSH. And there is generally a question about one of the three phases of the menstrual cycle. Question 13. The luteal phase of the menstrual cycle consists of menstruation followed by rising FSH, ovulation followed by pregnancy, luteinizing hormone rising creating corpus luteum, menstruation followed by falling FSH. FSH is follicle stimulating hormone. Question 14. Which hormones are responsible for puberty? FSH and LH, so that's follicle stimulating hormone and luteinizing hormone, testosterone and estrogen, FSH and testosterone, LH and estrogen. Question 15. Which hormones are responsible for the physical changes during puberty? Testosterone for girls and estrogen for boys, testosterone for boys and estrogen for girls, FSH for boys and estrogen for girls, LH for boys and testosterone for girls. Question 16. Which of the following body changes occur at puberty for girls? Increase in subcutaneous fat, growth of axillary hair and chest hair. Menstrual cycle begins, increase in height and pelvic width. Voice breaks, larynx enlarges and ovulation begins. Voice breaks, body and facial hair appear, growth of bone and muscle. Question 17. Which of the following body changes occur at puberty for boys? Increase in subcutaneous fat, growth of axillary hair and chest hair. Menstrual cycle begins, increase in height and pelvic width. Voice breaks, larynx enlarges and ovulation begins. Voice breaks, body and facial hair appear, growth of bone and muscle. Question 18. The common characteristics of the menopause are low libido and increased level of progesterone, low libido and decreased levels of estrogen, night sweat and improved sleep, increased bone density and weight gain. Right, so answer 1 is A, penis, epididymis, prostate and seminal vesicle. So if you look at all the others, there's things that are not in the not in the reproductive system. So bladder is in the urinary or renal system. The vulva is a girly bit, and the ovaries are girly bits. So that's the only answer that can be, because all the other bits belong somewhere else. Immature sperm develop and are stored in the testes. So they're produced in the epididymis. They're produced in the testes, and then they mature in the epididymis. So the epididymis is like a long curled up tube. As they work their way through the epididymis, they mature. Answer 3, the function of the scrotum is to allow the testes to sit below the body to maintain a suitable temperature for sperm production. So sperm doesn't like being at body temperature. And my answer D there, allow the testes to be retracted if the man is in danger and keep them safe. Some men can actually retract their testicles at will. It is definitely a thing. Answer 4. The function of the prostate is to add fluids to semen during ejaculation, and it also adds moisture to the urethra. So the prostate produces 2 secretions. One is part of the seminal fluid, and the other is to keep the urethra moist, and it often enlarges in males over 60, and it prevents complete emptying of the bladder. And it also, so when the prostate is pressing on the urethra, then you get the man will stand, try and wee, and he just can't. It takes a while to push it through. Answer 5. Which structures add fluid to seminal fluid? Bulbourethral gland, prostate, and seminal vesicle. So there's quite a lot of things adding fluid there. So it's obviously an important thing, a function for the body. The female reproductive system includes ovaries, fallopian tubes, uterus, vagina, and mammary glands. And again, looking at some of the other answers, well, the bladder is not in the reproductive system. The testes are boy bits, and again, the bladder is, and the ureters are not in the reproductive system. Ovaries store 1 million immature ova, which are present at birth, and you don't get any more. When they're gone, they're gone. Answer 8 is fertilization occurs in the fallopian tubes. So the fallopian tubes collect the egg, they suck it up, and then the sperm go through the vagina, through the cervix, up through the uterus, into the fallopian tubes, and that's where fertilization happens. And the fallopian tubes are like little hoovers. They actively seek out the ovum, and they act like little hoovers. And there has been at least one case where someone has got pregnant when they've only got one ovary and one fallopian tube on opposite sides, and the little fallopian tubes just sucked it all up and they've got pregnant. The uterus is a hollow organ which provides nourishment to fertilize eggs. Zygotes form during the process of fertilization. Gametes form during the process of meiosis. So meiosis is the type of reproduction that produces sperm and ova. The follicular stage of the menstrual cycle includes menstruation followed by rising FSH. That's follicle stimulating hormone. And again, a question on one of the stages of menstruation is common. The luteal phase of menstrual is C. Luteinizing hormone is rising, creating corpus luteum. So this is the 3 phases. Which hormones are responsible for puberty? And it's FSH and LH, So it's not asked, this question isn't asking which hormones create the changes in the bodies, it is which hormones kick off puberty. And we've only talked about these in terms of women, but actually they are in women and men. Although sometimes with men you'll see them with different names, but it's the same hormone. Answer 15, what actually makes the physical changes are the testosterone for boys and the estrogen for girls. Answer 16, at puberty, menstrual cycle begins, increase in height and pelvic width. And the boys, the voice breaks, body and facial hair appeal, growth of bone and muscle. And that's just a table if you on catch up and you just want to stop this and just have a look at what happens to boys and girls. Common characteristics of the menopause are low libido and decreased levels of estrogen. So common symptoms of the menopause are hot flushes, night sweats, insomnia, headaches, general irritability, and what many women struggle with, even more than those, are a fuzzy head, not be able to concentrate, not be able to think properly. And there's lots of physical changes during the menopause. And again, if you're watching on catch up, you can just press pause